And I thank Dr. Gupta.
I agree with the gentleman from Virginia. Without objection, the member from Puerto Rico, Jennifer Gonzalez, is waived on to the committee for the purpose of questioning witnesses at today's subcommittee hearing. Without objection, so ordered. Chair now recognizes Mr. Timmons from South Carolina for 5 minutes.
Thank you, Mr. Chairman. Dr. Gupta, thank you for being here today. I was a prosecutor for 4 years in South Carolina, and one thing that my worst cases had in common was drug use. Most of the people that irreparably harmed themselves, someone else, killed someone, did so while under the influence of a wide variety of drugs, sometimes many drugs. And, you know, I think historically this country has been dealing with drugs. We've tried to use the stick, and that might have been a little bit too harsh. We've tried to use the carrot. I don't think that's going very well either. So I would argue that we might need to have a more balanced approach to holding people accountable that are perpetuating drugs and profiting off of drug-addicted individuals, and also help people that do in fact need help. Drug addiction is real, and we have tools in our toolbox to help address that. Would you say that that's a fair assessment of the history? We used too much of a stick in the 70s and the 80s, and now we might be a little bit too nice?
Thank you, Congressman, for the question. I would say it this way. When we were doing what we were doing 50 years ago, we didn't know any better. I never questioned the intent of what we were doing. It was we didn't know any better. Today we know addiction is a disease and it has to be treated. We also know trafficking is a crime and it has to be prosecuted.
But you would agree that when somebody overdoses and goes to the hospital multiple times, that, you know, the first time you give them some education, maybe some resources. The second time, maybe involuntary commitment and do inpatient and try to help them help themselves. We don't really do that. We have recidivism as it relates to drug abuse, and we're now, well, real quick, just tell me about these harm reduction efforts, and how do you justify some of those efforts relative to helping people? Because I don't think giving people needles helps them. I think giving them inpatient rehab and helping to get them clean and giving them resources helps them.
So thank you, Congressman. As you mentioned, this person is suffering from a disease at the time, not often able to know what is needed. Helping them with overdose reversal so they can stay alive, because we cannot treat dead people, and I say this as a doctor. Getting them the ability to check their drugs to see if they have fentanyl, they can make a decision not to use it after that, is important and smart. Making sure the spread of chronic diseases doesn't happen, infectious diseases, and here's why it works. When I ran and saw the quick response teams in West Virginia, they would go back to someone and knock on their door for next day after that, after they overdosed, and we've got 30% people or more into treatment eventually, but just talking to them. And this is the kind of policy we need to be thinking in. How do we approach people, help them get into treatment? And sometimes as a law enforcement and a social worker going together to knock on the door and say, hey, what do you need?
Sure, I appreciate that, but it seems that a lot of our cities across the country are not really holding people accountable. We're not enforcing the criminal code. I'll give you a great example. You walk down the street in Georgetown with a beer or a glass of wine, you're going to get an open container ticket. But if you want to go smoke marijuana at Wisconsin and M, knock it out. I mean, you know, marijuana is federally illegal. And the fact that we have this nebulous enforcement mechanism where in South Carolina you go to jail if you are smoking in the military, you get kicked out. I mean, you know, we're failing. We're failing at creating a structure through which our society can thrive, and it's causing problems. What are your thoughts on that?
Thank you, Congressman. I can limit it to just marijuana. This is exactly why the president last fall took these actions. A, to make sure that people in federal system who are for simple possession of marijuana are pardoned, because it's about their life beyond that, challenging the governors to do the same, and then asking the Attorney General and the HHS Secretary to work through to look at what the current evidence is around scheduling in an independent way.
It's a very complicated issue, and I would argue that the federal government has lost the ability to enforce the law because it has refused to enforce the law for so long. And the fact that we have not addressed it in some meaningful way, creates a lot of problems. I'm a JAG officer, captain of the South Carolina Air National Guard, and we regularly remove people from the military for smoking marijuana. And you can't walk a block in D.C. without smelling somebody smoking it. So, I mean, we need to get our policies in line with carrots and sticks and need to have nuances to achieve our objective. With that, Mr. Chairman, I'm out of time. I yield back.
Gentleman yields back. Chair recognizes Mr. Goldman from North Carolina, or from New York for 5 minutes.
Thank you, Mr. Chairman, and thank you, Dr. Gupta, for being here.